and incentivizing programs for primary care physicians so that they are willing to go to different places. You know, we do have some programs currently in the United States, for instance, for primary care physicians to work on Indian reservations, Native American reservations, and you know, they get debt relief, you know, through, you know, for their medical school expenses. So I think that's the type of thing we need to be incentivizing. It's critically important, and we actually don't go far enough in the House bill.
Is Julie Murray here?
Please stand up.
Yeah, Julie, do you want to speak in a loud voice and tell the story that you told on your card?
Yeah, I spoke to Congressman Greenhouse on Saturday when I was down in Findlay Market, and he was talking to people, and I said, you know, I can run an example of a story that doesn't get told very often. It's not a tragedy. I'm a single, 64-year-old, self-employed with a microphone. For the last 15 years, I've been self-employed. The first 2 years, 18 months, I had COBRA from the place of my previous employment to close. Then I signed up for a single health insurance premium through one of the two major insurers in the city that will go unnamed. And within 6 years, the $200 premium had become $700. When it became more than my home mortgage, I said, I can't afford this. So for 2 more years, I went without health insurance. I'm in good health, everything was fine. Then my doctor said to me, you know, ethically, I really can't continue to treat you unless you're willing to get health insurance. Why don't you get an MSA? That's what they were called then, like we have in our practice. So I talked to my brother who's a doctor, talked to a few other people, went to a health insurance agent, and got an MSA that began in January of 2002. The fee for the health insurance that I had then through Central Reserve Life Medical Mutual was $204 a month with a $4,000 deductible. Okay, well, let's see how I do on that. 7 years later, it's gone up, the premium, 400%, which I thought was interesting because that's the amount of increase in the health insurance CEO's salary that they have. Medicare. So people say to me, why are you so involved in this health insurance thing? I've been working all summer on it, trying to get people informed about the truth of it and get us up off our butts to do something about it. Why do you care? In 3 months you're going to have Medicare. And I said, imagine, I think there are a lot of us who care about other people.
Thank you. We have several medical students in the audience this evening. Would you identify yourselves? Medical students? Okay. Well, did one of you write a card about a health story that you wanted read? No. No? Yeah, this lady did? Okay. You have to speak in a very loud voice. We do not have a roving microphone. I'll tell you what, why don't you come up to the base of the stage?
Care about people, don't wreck the economy with the
My name Heather Moriarty. I'm a medical student in my last year of training. And I see all day long people who are not pleased with their health insurance. One story I saw again and again and again all summer long is parents who work. They earn too much to qualify for Medicaid, and also too much to qualify for CHIP, but not enough to buy health insurance. And their kids have asthma, one of the most common conditions out there. And they cannot afford asthma medications for their kids. Those medications are not on the Walmart plan, they're very expensive. And so every single day kids come to the ER, children have to get admitted, have to spend 3 days in the hospital, and those are completely preventable if their parents could have insurance.
We're not censoring, we're trying to not repeat the same question.
The question is concerning abortion and the coverage of abortion, and whether or not abortion services would be covered under the House bill. I'm not going to please anybody with this. I signed a letter with 19 other Democrats saying I will not support a bill that uses public funds for abortion, period. That's existing law. That's in the Hyde Amendment in both Medicare and Medicaid. I think that's public policy of the United States. We should continue that public policy. However, I should tell you that this gets a little complicated if you start thinking in terms of your definition of public funds. If your definition of public funds includes any type of tax credit or tax break, then I can assure you that right now in the United States, every private payer that funds abortion is getting some type of tax credit from the federal government. And so we are using federal funds, if that's your definition, for abortive services. So just for clarity's sake, but in the public option, and the Speaker has agreed to this, that there will be no support for abortion in the public option.
He just answered your question, sir.
Thank you.
Sure, that wasn't the question. All right. And I'm going to say that I disagree with Steve, so friends disagree.
So the next card I pulled says, your constituents agree with the Enquirer. Set the reset button. Why can't we do this? I suppose we probably could set the reset button at any stage in the legislative process. You could restart the process, have a new bill. It'd probably be a question better suited for the senator himself. I think he feels pretty comfortable with the Health Committee's version of the bill. He feels like we did go through a pretty long process of this in our committee on drafting a bill that we feel comfortable with. So I think that would probably be his answer, is that we've dedicated 5 weeks to coming up with a good bill, bipartisan support, bipartisan input, I should say, and we feel pretty confident and comfortable with that bill.
The question is, how will the public option benefit our citizens? I think the way to look at this is it will afford, through the exchange, affordable quality health care for all Americans. It's affordable. That's important. The public option, and I want to be crystal clear about this, the public option is called a public option because it's an option. You as an individual have the ability to choose in the exchange what program you will pay for, what program you will sign up for. If you choose the public option, you choose the public option. If you choose one of the private pay plans, you choose one of the private pay plans. And I've heard a lot of talk about government takeover of healthcare. Well, that's not what this is at all. It is the public option in the context of a broader marketplace, in the context of the exchange. And so to the extent that the public option is part of that exchange, offering affordable quality health care, I think that benefits all of our citizens. I think it's important to remember as well that we are all paying for the uninsured.